Hello and welcome to another episode of the Anxiety RX podcast. I heard last month that we have over 1 million downloads now, so that's great. I appreciate you guys following me. I appreciate you supporting me in my sort of healing from anxiety journey. And today I've got another physician, a psychiatrist actually, Dr. Drew Ramsey, who wrote this great book called Healing the Modern Brain, which he sent me an advanced copy of. And I'm very happy to read this book because it does really align with what I believe in, that we can do so much more for ourselves rather than just sort of succumbing to medication. Not that there's anything wrong with psych meds, but it is one of those things. And Dr. Drew is a founder, a leader in nutritional psychiatry. He's written 5 books. He's a clinician. He's had over 40,000 hours of clinical experience. So he's been in the trenches. He knows what it's like. And that's why I wanted to talk to him today. So welcome, Drew.
Russ, it's great to be with you, everybody listening. I'm just excited to get to spend some time together thinking about mental fitness and healing the modern brain. And yeah, thanks so much for having me on.
Well, that term, modern mental fitness, is great. It's like what you mentioned in the book. And I think there's 9 categories of it. I don't know if you know them off the top of your head, but they're great.
I definitely know them off the top of my head at this point. Mental fitness, we can go through all of them, but the idea here with healing the modern brain, which I think everybody can appreciate, is, man, like the game has changed a little bit for mental health. Man. It's just different. And different, I think, both in like, boy, there's just a lot more challenge, but also more opportunity, more knowledge. You know, there's the modern brain is in a new setting. Mm-hmm. And so we focus a lot about, the challenges of that, but I also like to remind people there's opportunity. And in the new science of mental health, there's a lot of, I think, clear directions for us. And that's what these 9 tenets are about. It's sort of wanting to ask people and ask everybody listening to shift the model. I think it's where you and I resonate. Not that we want to do away with everything that exists, but for a lot of people, we want to add in something that we're not doing culturally and we're not doing clinically, which is about having a more preventative model where you're not just engaged with your mental health when it breaks. You're engaged with your mental fitness because you want to polish yourself and you want to take things to the next level. We all have stuff to work on. We all have ways that we relate, ways we deal with anxiety. We have maladaptive stuff that we all struggle with. And the more we're out in front and thinking about that, not that we have to be perfect, but that it matters a lot when we take care of ourselves and our mental health.
And there's no better time than now. To be proactive, because typically as doctors we see people when they break, right? Especially in psychiatry, right? You see people when they break. I as a general practitioner, I would see people as they are in the process of breaking. And the interesting thing about being a family doctor is seeing how mental illness runs through families and seeing the patterns, and then that sort of Freudian repetition compulsion. What was familiar to you in childhood, you will unconsciously replicate in your adulthood. And I would see this run through families so much. And nutrition was one of those things that I would often see fall to the wayside in families that were struggling, families who had, say, a father who was addicted to alcohol or was mentally ill, like my dad. There was a lot of things where, because I remember, like Cynthia, my wife and I were just talking about this last night. She was saying, you never really got the nutrition when you were younger. Like you would just run, like my brother and I, we're in sports a lot. So we would just grab something on the go. Right. And that's still my go-to. Like if you give me the option of making a healthy spaghetti dinner or, grabbing something from Subway, I will go to Subway virtually every time.
Well, Ruth, I like to hear that from you and kind of talking about that, Frank, even for all of the things you know about nutrition and health, that there's that default setting you have. And I love how your wife is kind of tying it back to maybe a disruption and not getting a sense of, I call it like full nutrition, where my request in nutritional psychiatry is that we pull away from just it being nutrients. Like we know you need maybe some more omega-3s. We know zinc will be great for your brain. But we also know for you, like working with you specifically, I'd want to hear about dinner time now. I'd want to emphasize that you and your wife are actually cooking together and like, oh, wow, what's that like for you? It's like, oh, and have you kind of sit and get satiated with all of the healing that, you might still pick Subway, but, what you've created and the ways that you've created more kind of knowledge and better patterns with the nutrition. And then to focus in on some stuff like that, where, Subway isn't like a guilty bad choice, but it's something that, let's say you're traveling for a lot of work.
Right.
That's where I'd be, wanting you to lean into some of those choices that, my clinical challenge is like, all right, what's the healthiest Subway order?
Mm-hmm. And I still try to do that for sure, but it's interesting you tap on that because I hate cooking. But I'll put a proviso on that. I'm getting much better at it now. Like my nights to make dinner are
what do you
Tuesday,
hate about
Wednesday.
it?
What do I hate about it?
Yeah.
I think that I didn't get it as a child. I didn't get, like, my mother was a registered nurse, very dutiful. My father had schizophrenia. So, the house was either in gross disrepair from him during an episode. He also had bipolar disorder. Or it was kind of steadily going along. But my mother was a nurse. She supported the family. So she would often leave like Tupperware containers of like goulash and this kind of stuff, and I got really good when I was younger at making things like Kraft dinner. I still love Kraft. I don't know if you have that in the States, but it's basically macaroni and cheese.
Yeah, we have Kraft macaroni and cheese.
Well,
that's
yeah. But it was a staple of my diet when I was a single guy, like when I was going through med school and that kind of stuff. And I have a friend, and I did stand-up comedy for 10 years, and that's not good for your nutrition either. And there's one of my favorite comedians, Sean Proudlove. He had this great joke about, he would come out on stage and go, I don't want to overly impress anybody, but I just want a contest. It says 1 year of Kraft dinner, and 1 year of Kraft dinner is 180 boxes. So even at Kraft dinner, they're saying, don't eat this shit every day, So I just love that joke. It's just one of my favorite jokes of all time.
You can see how, and everybody listening, you can see how food and nutrition and nutritional psychiatry gets right into aspects of mental health.
Totally.
That doesn't get talked about a lot. It's the first thing I noticed in psychiatry. One of them is I was in practice and learning to be a therapist, and I love being a therapist. In some ways, I'm kind of an old school psychiatrist. I see a lot of people weekly still. I do a lot of old school psychodynamic psychotherapy. There's the first podcast in my book tour where someone dropped Freud before I did. I was like, nice. Yes, Russ. Okay. I was like, yes. So just in the idea that psychodynamics and psychotherapy is fascinating and just a wonderful part of this. But you can see how we're not accustomed as therapists. And for anybody who's been in therapy, I bet your therapist during an evaluation didn't say like, hey, tell me a little bit about your food environment growing up, right? Tell me about you and food. And you can hear just with like 2-3 minutes listening to Russ, anybody who's a little clinically entitled, like we're all curious. Like, I'm imagining this dinner table now with the schizophrenic dad, and I'm imagining him when he's not symptomatic. Well, I know schizophrenia pretty well. It's an illness that also takes away some affect.
Mm-hmm.
And so even if like if you sit down with me and we're eating our favorite meal or we're having kale mac and cheese, but I'm a little what we call effusive. I'm like, oh gosh, love it. Like I share emotion. My kids are seeing emotion. Sure. Russ, depending on what his father's schizophrenia was like, because I don't want to generalize too much, but Russ's dad might have enjoyed it just as much, but maybe not because his dopamine tracks are a little affected by the illness, but also he probably didn't express as much emotion. And so then as you kind of play that forward in a developmental milieu, an environment where there's not a lot of enthusiasm, there aren't moments where Russ and his dad are finding some solace or some comfort in chopping up vegetables, or my son has a couple things he makes this 3-pepper salad. And I love talking about 3-pepper salad. I love requesting 3-pepper salad. I love when I was planning out a menu, I was like, you got to make, because it's not just the fact that yes, red peppers are great and they have so much vitamin C, and orange peppers are great and they have so much. It's relational. And I think it's that part for nutritional psychiatry. The psychiatry part of it isn't just the nutrients that are good for the neurons. It's the food that's good for humans and the interacting in it in a way and intentionally in a way to like kind of maximize the squeeze for you, maximize that juice of like good human stuff along with all these great nutrients.
And it's nurturing too. So I'll give you another little snap. You seem to open me up pretty wide to start here. Is we didn't have a dinner table. So basically we would have TV tables. So there'd be my dad in his chair, my brother in his chair, and me in my chair. And sometimes mom wasn't even there because she was working afternoons. So she would make stuff that we would just toss in the microwave or whatever, and just sort of, and we'd watch sports, and we would just sort of, we wouldn't talk. We would basically just be glued to the TV. So I think, you've hit a big nail on the head here, which just asking about the history of food in a family. Was there a dinner table? I'm sure you asked this, but what were your expectations around food? Was it provided for you without, without condition? Was there
this is a huge food insecurity. Sorry to interrupt, but food
No,
insecurity, which is just that kind of idea, like are there conditions, or you're not sure it's going to show up, or mom and dad are too disorganized, or drinking too much, or just not really good at keeping you secure about the plan for food. The correlations with adolescent suicidal ideation, thinking about suicide, clinical depression, it's very, very, I think it's 2 to 8 times increased risk of mental health problems, and I think 4 or 5 times increased risk of suicide. I mean, it's just very. I know the stat, and the elderly, which is another big population at risk for food insecurity. If food insecurity increases the risk of depression by 10 times. And so again, there's all this way that food relates to our mental health, where we've got to get beyond this thinking of, okay, there's this one superfood, it's called a lentil or an anchovy, or, I got a question from the media today about eating raw testicles. And my first thought is like, organ meats are very nutrient dense. I was like, wait, that's not what you say. Like, this is, I start Googling PubMed. This is like being an influencer today. Sure. It's like, does eating a testicle increase testosterone? Like, I don't think so. I think you digest the hormone. But
yeah, I don't think it would.
Anyway, but the point of mental fitness is to take this insight that I had about nutritional psychiatry, which is that we weren't approaching mental health using the tools that we have of food. That, if you're eating fast food all the time and you're gaining weight and you're drinking a couple beers a night, kind of, again, standard American diet, you have a massively increased risk for depression. When you do get depressed, it's harder for you to get better, but we're not engaged with food. So that struck me as a problem. I kind of felt a similar way about these other tenets, these things that we can all agree. Like, we all agree food relates to how we feel. We all kind of agree, hey, just in Russ's story, there are some great opportunities for him to do some really powerful healing around food. If he were my patient, I'd be wanting actually 2 things. One, I'd be thinking, how do we create some of that like family vibe that he had of like dinner around the TV watching sports? Like, is there a sport that he and Cynthia like to watch, where I'd want him to tap into whatever feeling he had, and along with, no dinner table. Russ, do you have a dinner table?
We do now. Oh yeah, for sure. And Cynthia's she's very good at, bringing us all around the dinner table and talking and connecting, and there's no phones at the dinner table and that kind of thing, which I'm pretty guilty of. It's like, oh, I just want to check this or I want to check that, but I'm really good at doing that. But you hit on a really good point. The amygdala has no sense of time, so it will actually record your I don't know, gestalt, your wholeness around food. And
for sure. And it's one of those primal ones. It's one of those primal ones, like safety. If you grow up in a house where people are like, oh, honey bear, like how do you want it?
Right.
When do you want it? Which flavor? Is it too high? Kind of Goldilocks, which I think a lot of families and kids get this, which is like, hey, we want you to feel like we're taking good care of you and giving you what you want, which, is a little bit of a challenge because that's not exactly what life is like.
Yeah. And I'll often say that too. Like, did your parents show a real interest in you? Because if they didn't, you don't really gain this sense of gaining a real interest in yourself. And you often, like kids will often start helicoptering around their parents and seeing, what can I do for them to get my needs met? So if the parent isn't safe, neither am I. So then what they do is they learn how to read the parent and give the parent what they need, sort of nurture the parent in that way. And then
we call it reverse parentification. Yes. This is where it's like the psychiatry term where, you kind of end up turning the kid into a parental figure. And, some of that I wouldn't say is inevitable, but there's a way, at least for me as a parent, that the assessment of your kids, whether you tried, the assessment of your kids, like, did you do, put some effort in your life to understanding this thing that's important? I think that counts in a different way. It almost gets a little parentified for everyone, I think, if you're paying attention. But, what you're talking about. As they get
older, as your parents get older, because my mother's 91 now, we do tend to sort of, adopt that parental role with them. But it's sort of a natural ebb and flow of life,
That's a weird part here at the end where you're
the parent.
Yeah, I looked at looked at my very sweet, kind, loving dad, and he's gotten into a big kind of he has a bit of a habit of getting enthusiastic about building projects. And I looked at him and I said, "What are you, 15?"
Yeah.
I felt badly. He's a man in his 80s. He's had a life. He can do what he wants with his time. But, I had this real feeling like, God, I'm being more adolescent than is appropriate. And I'm the parent here. And it's very...
and that's where I think that's where people pleasing comes from, Drew. I really do. I think that kids that don't get their needs met by their parents learn how to meet the parents' need. And that becomes a pattern that they get their needs met in a very backhanded way. And then they just sort of follow through with that for the rest of their lives. They become sort of people pleasers because they get really good at reading other people because they had to be really good at reading their parents.
Right. Yeah. And then they go to medical school.
Exactly.
Right.
Exactly.
I think a lot of the burnout that we see is what you're saying resonates for sure with me. I took a lot of pleasure in being, the responsible person in my family in a lot of ways, and that pleasure of caregiving, of being of service, and also I like what you said. It really allows you to form a self that isn't about the self, right? It's about the self as a caretaker. It's about the self as a soldier, as being of service, as a giver. Which again, all great human traits, all super important. One of the tenets. Very important tenet of mental fitness I talk about is a tenet of connection.
Right.
And, for me, I feel incredibly connected through my service, through my clinical work, through, it's just, so I don't want to, dismiss that in any way, but there is a way that when people's life is about that and there isn't a service and a connection to the self. And I write about that in Healing the Modern Brain, where one of the things we've really lost is this notion of a connection to the self, where, as we've gotten more kind of performative and as values like of being of service and being involved have gotten to be more culturally relevant, people struggle. Like I hear this all the time from patients, like, I was trying to have like a bath and I just felt kind of guilty because there was so much to do. Shouldn't I be doing this? Shouldn't I be doing that?
So I think, if your parents have this real interest in knowing you develop this real interest in knowing yourself. And that creates this foundation. And what Gordon Neufeld used to say is that it's supposed to go downhill. Like that's the way, not downhill in a negative way. It's supposed to, the parent is supposed to be the answer for the child. And then once that foundation gets set and the child has their own sense, like, okay, I am taken care of. Now they can take care of others in a healthy way, as opposed to sort of a codependent way, like trying to get their needs met through helping other people.
Russ, you're talking about this after they separate and leave. I'm not interested in that part after they leave me behind.
Yep.
Yep.
And that's what happens, And food really does. It's a real metaphor for how, this is what I wanted to talk to you about when I first found, I knew I was talking to you today, is how do people nurture themselves? Because I think that how you feed yourself is a real benchmark as to how your mental fitness is fed.
Oh, for sure. In the last book, I have a chapter, Eat or Heal Thyself, which is about assessment and thinking about, hey, if your fridge is disorganized, that's bad for your self-esteem probably, right? If you're always, kind of racing to Subway at the last minute, like Russ said he sometimes do, hey, you're not taking care of yourself as well as you should. Yeah. So I think about it as a diagnostic sign. Not that I'm trying to judge someone like, oh, messy fridge, disorganized, but more of like, hey, where's our opportunity for you to settle into the self more? To be more of the true self, more settled down, more in that kind of IFS, kind of state of like, hey, let's think about who you are, what your values are, what's informing your decision making. DBT calls it wise mind, which I like that phrasing a lot as well. Right. And then think about your nutrition. And I find a lot of people haven't had time to sit with their values as an eater. For a while, I was a vegetarian. It was for, I would say, not the best science and not the best reasons. Okay. Over time, I became much more of a kind of local farmer-focused eater when I was in an urban area going to farmers markets. In this period of my life, I'm really focused on I don't honestly care so much what we're eating. I mean, my wife would tell you that's not true. I'm a little, challenging at times to cook to eat with. Sure. But what I really care about is that the four of us, our little nuclear family, is sitting around the dinner table most nights of the week, and that I'm really doing the best job I can listening, which sometimes is a little tough for me as a psychiatrist, listening all day. So it's less the nutrition and it's more that nurturing you're talking about. But, there's certainly, there's always some, last night it was cut apples and cut cucumbers. Oh, so good, but just a great way to sit and chat and snack. And so that nurturing that you're talking about is a big part of mental fitness. And it's really where the framework came from for me, Russ. I moved here to Wyoming. And I'm just thinking like I really needed to double down on taking care of my mental health. But, I do a lot for that already. I'm in therapy. I've been in therapy. I have a great and supportive team who takes care of me in all kinds of ways, ranging from my super smart, savvy bookkeeper to some of the therapists on our team who I meet with weekly who are, we try and take care of each other, but they're always very, I get a lot of great support. And so a lot of those, basics that I think sometimes people need, I had, and I needed more. And I realized that, I kept focusing on like, I need to go for a run or I need to go lift. But beyond movement, there wasn't like almost like a checklist of, hey, today was a good day for my mental health because I did these things, beyond the kind of what, everybody could muster up. And as I thought about, people in my life, and thought about my patients really who would like turn a corner, there were these things that you see, someone works really hard on forming more human connections or getting out and dating. When that begins to pay off, you see their mood improve, you see their kind of affect brighten up, you see their engagement, their motivation change. Same thing, you take somebody from not sleeping to sleeping. This just happened to me 2 weeks ago. I'm working with a guy who's just really bad news at work, really caught him off guard, blindsided, just grinded, not able to sleep. Then that's all making it worse. I mean, looked horrible a few weeks ago. I saw a buddy of it. He looked great, a little smile on his face. He's sleeping great for the last 2 weeks. Not a lot has shifted other than he's doing some more journaling. The first tenet is the tenet of self-awareness.
Right.
And I got his meds a little dialed in better for sleep. And, he's doing a lot of good work and is reflecting. But the point being that the tenets of mental fitness are things that we all can agree on. And if we work on them, they pay off for our mental health. If you improve your sleep quality, for example, in Healing the Modern Brain, I go into a lot of the details of sleep hygiene. I go into, air quality and just, not
Get rid
that
of
you
the
want
phone,
to, making a row with the phone, right? It's like getting natural fiber sheets, right? So everybody's all worried about microplastics. There's that question, well, what do we do about it today?
Mm-hmm.
And besides not heating our food in plastic, getting some of the easily aerosolized plastics out of your house, filtering the air in your bedroom, controlling noise, controlling light, all things that we have some control over. So these are these aspects, again, of mental fitness where we got to do a better job than saying, oh, yeah, no, I got to work on my sleep, right? Like I try to get 8 hours. I do okay.
Yeah.
That's not good enough. It's like with nutrition, it's like I'm all for being generous and kind and flexible, but there's a way that I think all of us can lean into that a little bit too much these days. And we're just overwhelmed. We all know we're on the screen too much, but you know what? We're still on the screen too much.
Yeah.
And so the book's really asking us all to step into a more active stance and take care of your mental health. You can still get on the screen. You can still eat steak. You can still procrastinate. You can still get 5 hours of sleep some nights. But I really kind of ask everybody to be realistic and look at the numbers.
Mm-hmm.
And this isn't about other people's mental health problems. This is about your mental health problem. And a mental health problem is coming for you. If 50% of men get a substance use disorder in their lifetime, either me or Russ are going to have some real challenges. If we see that 80% of men don't get any treatment for their mental health disorder, if we see just these stats piling up, whether, we always go to the ones that are horrible, like suicide statistics, awful. Yeah. But that's kind of, I call it like the tip of the iceberg. It's makes the headlines. It's horrible. It's a horrible tragedy. But the other markers of our mental health, people's motivation, their community engagement, their trust of their neighbors, their sleep quality, their engagement and satisfaction with their work. These are all mental health markers in my mind. And if we don't get active in working with them, they begin to erode in this modern life. And I don't mean that in a fear-mongering way. I think we should all just be upfront about it. You spend your life on your phone or all of your time on your phone. You don't make connections in IRL. That doesn't feel good. You are only sitting inside on the screen. You don't get out into nature. Grounding is another one of the tenets. you're not going to be feeling as good. Your brain's not going to be as healthy. So that's where these tenets come from, is really this clinical experience.
I mean, I like the unburdening one. Like, that's what I deal with most people. Like, I go into, where your trauma sits, and I have this theory that, unresolved trauma in childhood that wasn't repaired winds up being this state of alarm that we hold in our body, possibly through the insular cortex in the brain. So there is this thing about, well, you can't hold trauma in your body. It's like, well, maybe not, but maybe the insular cortex holds a sort of a map of the body. And what happens is that maybe the trauma isn't held in the body, but it's held in the brain's representation of the body. So it becomes this philosophical argument after a while. So, this alarm that's in our system that wasn't healed when we were younger, it will show up in different ways. And I think that we spend a lot of time trying to fix the machinations of the cognitive mind, when basically those machinations are a byproduct of this old alarm that's stuck in our body or our brain or our nervous system, wherever it's stuck. And I have this theory about the alarm anxiety cycle. So the alarm in our system that developed when we were younger tricks our brain through interoception. The mind's always reading the body. It senses this alarm and it makes up a negative story to be completely consistent with the negative feeling of alarm. And then we believe those worries, and then the alarm gets worse, and then you get caught in what's called the alarm anxiety cycle. So I believe that anxiety is actually two things. It's the anxious thoughts of the mind, but it's also this alarm state in the body. And anything that we can do to decrease that alarm state in the body is actually healing the root cause of the problem, as opposed to just trying to fix the machinations of the mind. There's nothing wrong with cognitive therapy. It's actually very, very helpful. We're very cognitive creatures. But when we ignore this sort of alarm state in the body and just try and fix the mind, we're sort of, running at cross purposes. We never actually fix the underlying problem.
Yeah, I like that approach a lot. And I think it's very, certainly with the physical part, one is a psychiatrist, right? It's part of our job to screen out some of the physical conditions like hyperthyroidism or low B12, right? That, and as a physician, you too. But there's a lot, I think, for patients, and misreading cues is very common, probably most common in panic disorder, right? Where patients begin to have a little bubbling in their tummy or a little bit of intercostal rib pain, and it really, their mind goes with it. And it becomes, potentially a medical emergency for them. And so, there's certainly the kind of being able to sit with the body and sit with anxiety in the way that people get, whatever your word is, whether it's activated or triggered. But, that's very true and very challenging, especially for people who have a lot of trauma and haven't had a lot of awareness of it or orientation around that. Then I think what you're talking about with the mind is true. It's also where I think people approach it very consciously, and there's not a lot of great therapy out there. That sounds meaner than I want it to, but it just, there are like hundreds and hundreds of types of therapy.
Totally.
I work with lots of folks who are connected to everything. Their mental health network, is they navigate every part of the world, but mental health is hard for even people who are the most connected and have the most resources to navigate. And so a lot of, I think, what happens in therapy and therapy around anxiety is, one, there's not great kind of high quality CBT a lot of places, but also a lot of the, what I call relational or psychodynamic piece, the ways that there are unconscious patterns that get involved in everyone's mental health, anxiety, these psychodynamics, as we call them, and the way that relational patterns get reenacted and recreated, both with the therapist and also with new relationships, new objects. That part, I find that part of therapy so great. And so, but, I really hear what you're saying, which is, for a lot of people, the talk therapy isn't as effective as they would like. I also think there's a lot of people who, as their default mode network is stuck, if there's a lot of childhood trauma, part of what therapy, in kind of normal talk therapy, it sucks, is that you have to talk about it again.
Right.
And so a lot of therapists aren't very skilled in how you gradate what we call surface to depth. A lot of trauma therapists and a lot of therapists in general, if you are a victim of a violent crime or a rape and you come into your first session, a lot of people are really eager to hear about it. They think it's great therapy to get in there and get all the details and take a history. And, they feel really like, wow, the person finally opened up to me. I hear that a lot from, and and they'll make interpretations about like this or that or ways to be helpful, and it's too deep, right? It's too much too fast. It's not allowing an alliance to form. It's not kind of putting yourself in a position clinically to treat anybody as something other than their trauma, right? And so there's there's also, I would say, the new era of how people are approaching mental health and trauma, whether it's the psychedelics, whether it's, I would call it, frankly, the anti-psychiatry movement, whether it's, whether it's interesting stuff like one of our team members, Samantha El-Kharif, is this wonderful Columbia trained social worker who also has a lot of training in somatic experiencing. Mm-hmm. So you're having this, real mix of traditional and more holistic and integrative credentials. Someone like yourself is a great example of that, right? You're a family practice doctor, but now you're using IFS and
I'm also accredited as an SEP as well. So so I try, and that's the thing. Like, and people say, "Well, you're not a psychiatrist." It's like, no, I'm not. He says, you weren't trained as a psychologist, and I said, no, I'm not. And I said, in a way, that allows me the freedom to kind of choose. Because basically, I talk about what helped me heal, because I went through all. I mean, I think the other day I figured out that I'd seen 36 therapists in my life, and of those, 12 were psychiatrists. So, for 30 plus years, I was kind of in that sort of cognitive kind of realm, taking SSRI, SNRIs, and just it sort of dampened the symptoms a little bit, but it didn't really do anything for the underlying cause. And when I found psychedelics, when I found somatic therapy, and to some extent IFS, I was like, oh, these are really zeroing in on the somatic, the feeling, the subcortical parts that sort of mediate the anxiety in the first place. And if you're dealing with a limbic, cortical or subcortical pattern, dealing with, talking about it doesn't really penetrate into that. But we do need that we need both. And that's my thing, is that we need both the somatic side and the cognitive side. So it tends to be, some people go fully somatic.
Yeah, you're calling it cognitive too. And I think it's where it's like, I don't think about it as cognitive, because
even though it's
for
called
me,
cognitive behavior therapy.
Well, I think it's because I'm not a cognitive behavioral therapist.
Right. Sure.
So I think it's a different orientation. Like, I think about cognitions, but like when I'm in session, I'm not thinking in a CBT model. I think in a psychodynamic model. Mm-hmm. So I'm thinking about how the patient seems, or how the person seems to me. Right. I'm thinking about where we just went into, if the session's starting, it happened today, where like, somebody was like deep into the med protocol, and like, I'm happy to start there, but like, I usually like to hear like, how's it been for the last week? Right. Yeah. you had a date plan that sounded exciting. Like, how was it? But there's a lot around how it kind of feels, like the feeling, what we call like following the affect, of how, if somebody is sad and tearful, I'm going to kind of follow as they explore that and share with me what that's about. And so, but I certainly hear the cognitions. In a way, I hear this, Russ, is that some of these tools work for different people. And I think the part that we're having a hard time with in mental health is where people have tried CBT, or they've tried therapy, or they've tried meds. One, there's a large proportion of those people who've had horrible treatment. Yeah. They've had one SSRI trial. Somebody didn't dose them right. Yep. They had a bad reaction. And, or they've had CBT from someone who, is either new, or just, like everything, there are people who are better at this than others.
Totally agree.
But they're really clear it doesn't work. And I think I often see that, where, there's just been not any evidence-based treatment that's good. Then I think there are a lot of people who tried everything. They've been such good patients. They've tried meds. Your example, me. Like, right, you tried a lot, right? You tried, like, you're like, yes, please. I'd like to have less anxiety. This med works. Okay, let me try it. This med works. No, let me try that one. This therapist might be better, where you're trying to find a good fit, and you're not finding it until you get into the integrative world, and something like psychedelics interrupts, and you feel differently, you feel better, you maybe get some lessons, some wisdom, or you go into a retreat, where I see this a lot, where people aren't able to kind of sit with it with me, because I see this. We have a journey room here. We do ketamine assisted therapy, and I was trained in a retreat. model where, you're away from your kids and your
Right.
job and everything. But I'm practicing here where, someone does a ketamine journey and then they go home, and as much as we try and plan it and have it be protected time, one of their kids is sick.
Yep.
Or they're suddenly back at home and dealing with homework, and so it's anyway, all to say that I think it's important for everybody listening to hear. And I think what you're saying, Russ, is that, there's a lot of different ways that people get better, and exploring a variety of techniques, especially if you're not getting better, is important, because I think people can to feel much more hopeless and more stuck, and that there is an opportunity for them.
And you bring up a great point with the psychedelics, and ketamine is a dissociative more than a psychedelic, but it is one of those things where there isn't the integration after, so if you're on a retreat.
Well, you're thinking about IV ketamine, and I would say that ketamine dosed properly is a full psychedelic. I would say that for sure in my experience of like psychedelic experiences, like hallucinations, complete dissociation from like time and space, like I think it's a different psychedelic from what I hear from people who are more experienced in like MDMA and psilocybin. But I definitely, if you dose it under the fully anesthetic part, you get a really interesting psychedelic experience. I've had people, well, I'm sure you know about this stuff too, Russ, but for everybody, people like, flying over, villages, and people having full. But tell me your thought of it. You think about it differently, though. You think about it more dissociative than psychedelic?
Well, classically, what I've read about, like, that they do tend to put ketamine in this, like, whether it's nomenclature or whatever it is, but they tend to put it in a different category than typically the psychedelics,
it was
peyote, ayahuasca, that kind of stuff.
It was the wife of the chemist that discovered it.
Oh, Graf.
Who named it a dissociative anesthetic. That's where the name comes, because you do kind of dissociate. I found that to also be a little bit of a misnomer.
Yeah.
Like my body is very active on a ketamine journey. I do a lot of it's sort of odd to me, but it's like prostrations and things. So it's but anyway, some of the tools that, again, people haven't in the past experimented with, or we haven't thought about as much with in a clinical space. People have always experimented with these compounds, but we haven't thought, hey, you have anxiety that hasn't responded. There's a set of experiences, retreats, compounds that could be helpful to you.
Yeah. And, one of the things that I see about anxiety specifically is a lot of people with anxiety are very much related to control. They want control. And the thing about the psychedelics is they take away all your control. So people will say to me all the time, should I do this for my anxiety? It's like, well, do 3 to 6 months of somatic therapy, grounding yourself, eating properly, all this kind of stuff, and then consider it from there. Because sometimes after 3 to 6 months of somatic therapy, or a bit of IFS, or a bit of maybe microdosing, they don't need to do the full sledgehammer at that point. Like, they are getting better. Now, some people do.
Well, I also think that approach, I find that a lot of, I find people in the psychedelic movement also complain about this a lot of, there's a lot of kind of magical thinking of this being finally they found the silver bullet. And
totally,
I think this is, in some ways you see that, it's like those folks haven't practiced psychiatry.
No.
When you practice psychiatry, you give people silver bullets all the time. We need a better phrase than that, but you give people compounds that really help them in miraculous ways. And you give other people the same medicine with similar symptoms and it doesn't help. And so it's, but anyway, this is in some ways, to get back to this notion of mental fitness, where I wanted people to hear from the part of psychiatry that isn't just about meds, but is about a more modern framework. This book is really about neuroplasticity and like, how do you harness that? Like, what is that? How do you think about it? And to kind of ask people to up level and kind of get more modern in their thinking about mental health, to think more through the lens of neuroplasticity and inflammation and the microbiome and kind of modern psychological concepts. Because I find, and it's a little disconcerting to me, where people are spending a lot of time like, getting off arguing about whether serotonin is important or not. Or arguing about how efficacious SSRIs are or aren't. And that's like a very individual question, honestly. Totally. Like but it becomes this kind of focus of the mental health conversation in a way that I found wasn't really what anybody in actual mental health is talking about. Like, yes, we still use SSRIs, but when I think about Prozac, I think about the very cool Prozac studies showing Prozac's essential anti-inflammatory. And that's one of the ways that it works. And it's like, when you have a patient with a lot of inflammation, Prozac might be a better choice than the other SSRIs. Or when you see some of them trigger neuroplasticity and BDNF more than others. That's the kind of data that it's new. It's really fascinating. And just like, there's a set of new data around food and mental health. If you have clinical treatment-resistant depression and you're eating a horrible diet and you start eating a Mediterranean diet, in studies, 32 to 36% of the patients who are eating a healthier diet go into full remission. Right? I mean, it's just like, that's as powerful as it gets. And so it's very cool new science. And I think, again, this idea of mental fitness is we got to do more. It's not like, you hope someday you don't have depression. It's that, hey, the world has gotten a lot more factors driving depression. You are probably at risk for it. There are lots of things to do to protect, insulate yourself. And if you do get depression, help you.
That's the thing. You're not a victim. There's all these things, like the 9 things that you talk about in here. We can do these things. They are doable. They're not. I think there is this sort of magical thinking that, Aunt Sally had, manic depression and saw a psychiatrist for 50 years and never got better. So we look at, all psychiatrists are they don't know what they're doing. They're all pill pushers and stuff.
I love also this idea that people, I guess, think it goes away. Like, for my patients who've seen me for 20 years, I've got a couple. The patient who I've treated for the longest, I started treating in 2002.
Okay.
And when I met him, he was a carpenter. He wanted to be a professor. He was single. He wanted to be a husband. He hadn't had many long-term relationships. He'd been hospitalized 7 times on 4 different continents. I've known him his entire professional life. He's known me his entire professional life. It's one of the relationships that I'm proudest of. I hope I get to treat him for 50 years because today he's the chairman of a department at an academic center. He's a teacher, he's a professor, he's a father, and he's a husband. And I think there's this notion that people have mental health that, like, I'm supposed to go away. And that sometimes happens. People come, they get better. I have I get something right about a medicine or an interpretation, but I also think there's this kind of looking down on, I've heard a lot of people actually in the psychedelic talk about, like, this dependency. And I think what gets misconstrued about that is, the dependency is on somebody who really wants to understand you for who you are. And if you have bipolar disorder, take great care of you, period. And that involves getting to know somebody and often meeting them somewhat regularly. And there's a kind of chronic viewpoint on some of these illnesses. If you have clinical depression, you might not need to see me weekly forever. But I think my patients who have seen me weekly and get better and stop, they like having my cell phone number in their phone. And they like, I hope, knowing that if anything starts to go sideways for them, I want to hear about it and help them. If they're not in some place where I'm going to work with them, I'm going to start a little bit and get them transferred to somebody who does in their local community. But, but I do think there's that, idea that people have where it's like they want the psychiatrist not to be involved with people who have chronic mental health conditions in a way that, to me, shows it's sort of like when people think riboflavin is a chemical to get out of our food. And they don't understand that riboflavin is vitamin B2. And
I saw that clip of our RFK talking about that stuff, and it just, it makes me shudder. It kind of, when you're talking about that, it kind of reminds me of when I was in practice and people would have panic attacks, and sometimes with some people I would give them a couple tablets of Ativan or Xanax or whatever, and say, when you have the panic attack, take this. Right. And they would take it and then it would help them. And then all they had to do was have it in their pocket.
No, this is 100%, Russ. We see this all the time. I feel people, I said, do you know, you're going on a flight. Do you need a refill? I say, no, I still have that Xanax or Ativan prescription that you gave me like 25 years ago. And they're very proud. Like, I haven't taken any. But and I think it's where you're noting that, some of anxiety for a lot of people is about control. and being in situations where the locus of control is, starts to get distant from you, or you get into situations where it's very clear you don't have control. Flights are a great example. And this is an example where I think having information, having some emergency meds, knowing there's something you have that could make it stop, gives people an incredible amount of kind of strength and resilience. And it's kind of like, if you know that it's just another quarter mile, you can push through. If you don't know where the finish line is, it's a little harder to, it's harder to kind of regain control of the self and keep pushing. So I think it's, again, one of these ways that I want people to hear mental fitness, whether it's in the context of you are in treatment and you are wanting a framework to keep working on things, right? And you're wanting some inspiration there are some great stories from really wonderful people I've worked with, but I think also there's inspiration in the science. For me, as I was working on the book, and I've always loved walking in the forest, but I'd never really heard the data about phytocides, which are these compounds that trees create that float around and improve our immune response. Or I'd never really seen the data on what seeing green spaces, or there's actually a meta-analysis. There's 7 trials, clinical trials, of using forest bathing and nature experiences to treat clinical depression. And so, there's just a lot of cool data that kind of help back up some of, again, what I think people know intuitively. These are tenets that help our mental health, and then giving people encouragement how to engage, whether there's some journal prompts in the book. There are recommendations for how to build more connections. I have this kind of exercise of building your web of connection in your life. There aren't any, this is my first book without recipes. My other books, all my other 4 books have recipes, but this one has some food recommendations and a nice chapter on nutrition. And so I hope it helps everybody get active and think about their mental fitness. And I think your audience and everybody listening, has been hearing this kind of stuff from you. And so I really hope it resonates, and I hope people check out the book.
Yeah. And I think it's, so much of anxiety, depression, eating disorders, just emotional dysregulation is that self-separation, is that you didn't get that connection that you needed when you were younger. And then we try and reproduce it. And that's, I think, why people are such sitting ducks for addiction, is because the addiction sort of gives you this pseudo connection of yourself. I've always said, Ativan or Xanax and that kind of stuff, they're just like a pseudo hug. Like it allows you to sort of stop.
Alcohol. You should put alcohol on that list. I mean, these are all GABAergic drugs. Everybody knows that feeling where it's like a couple sips in and you're like, just like a hug. And it is. I think there's a lot of that. It's actually how I practice relational psychodynamic therapy. In part, is having a boundaried, very close, very known relationship with someone who is neutral in the sense that I'm really there to live according to your values, not mine, but very interested in your goals and in an active relationship with you. Again, boundaried and professional, but it gets really intense being a person's therapist. And people talk a lot about that good therapy is reparative, because you have to confront the parts of yourself that struggle to have a good, healthy, boundaried relationship. And then all of the ways that people are disappointing, or, all of the ways that being confronted is uncomfortable, or all of the ways that therapists can be wrong.
Right.
It all kind of comes out in the relationship in a way that, if people hang in and work it, is very, very, therapeutic. We're talking about it's a reparative model of a relationship where you get to talk it out. And I think that's what's different than, the types of therapies maybe you're talking about, where people kind of get stuck and you're talking about the same thing. I mean, certainly I have patients who are talking around some of the same issues. And there can be that period in treatment, in any treatment, I think. But I think the relational piece allows there to be like a different language, right? This just happened today. Like I was saying, I said, "Oh yeah, no, you said that thing," and I was like really pissed off at you all last January. And it's like all of a sudden we're back in last January,
Right.
And I know exactly what he's talking about for the moment. Well, I think I do, right? I hear about it, I hear more, right? But it's this really interesting moment where I gently confronted him on something that, he's getting a lot of positive feedback about something done that he was, there was more to the story, let's put it.
Right.
So, all to say, it's great to be talking, and I hope everybody listening, here's the, I think, enthusiasm you and I both have for people getting better. And I think that I certainly take a lot of pleasure in the folks I've treated for a long time, but I think it's also important that people get better when they engage in treatment. And whether it's somatic treatments, whether it's a therapy where there's a good fit, whether it's, some people go more of a natural and supplement route. Some people are really interested in some of the new generations of meds. Some people go psychedelics these days, but it could be overwhelming, but there are a lot of options. And I hope these tenets give people a kind of foundation.
Yeah. And they're all very repair based. I mean, I think that's what happened to us when we were younger is we didn't get that repair. So we have a chance, and I often say that sense of alarm in your body that you can actually drill into, for me, it's in my solar plexus, it's hot, it's purple, it's crystalline, it pushes up into my heart, it pushes back in my spine. I can use that as a conduit to the younger version of me that was, say, bullied or watching my father go psychotic. I can use that sense of today to immediately communicate with the child in me. And then I have a picture of my younger self in my mirror, and I chat with him all the time because I think, 70% of our brain is devoted to our visual cortex. And I think it really does. Seeing that picture of yourself as a child, you can feel so much more of that child when you see that image as well. So it's really,
I love that technique. I have that. I just visited my parents' house, and part of what I think is interesting is seeing like the pictures of yourself at different phases.
Yeah.
And I think having a couple of, there are a couple of different ones I talked to. There's this like one, it must have been 10. I barely recognize this kid. He was very surly and upset. There's like the big goofy smiling 14-year-old. I love that kid. I like to talk to him. There's a number of different like stages of development of the self that, again, it's where I think the journaling is a wonderful way to kind of, I have a couple of guys I'm working with who are new daddies. They don't have any time and they're tired and they're burned out and they're working. But I was like, I know this is super annoying. I want you to sit down and write a little bit. I just want you to journal a little bit, just a page. And they're like, I don't have any time. I'm like, this is just a really special moment in your life, and you're going to remember it. You're going to have pictures of it and videos, but you're going to write about the words you're going to choose. They're going to bring you back to it in a different way. And so, all of us, again, being intentional, being engaged, thinking through these tenets, the basic ones I think people know of, although I think the mental health part is new. Like everyone knows like food relates to mental health.
Oh, totally. Yeah.
Kind of. But when you talk about it, you're like, I didn't really realize like nutrition related to my depression so much. And so it's really kind of interesting when we start, again, thinking through some of these basics of lifestyle medicine, sleep, movement, nutrition, and then adding on the parts of modern psychiatry, thinking about unburdening and living a life with purpose and building our interpersonal relationships.
Yeah. And I think building that relationship with yourself is just so critical. So one of the things that I've learned when I go and read studies, that's every morning for an hour, I read studies and I have these little flashcards that I sort of create my stuff on. And there is a study about how whispering affects the brain. So when you whisper to yourself, when you whisper something, people automatically pay more attention to it. Because
so you whisper to that picture
you whisper to yourself. You whisper, for me, it was like, it must have been really hard. It must have been really hard when you were bullied. Like the microphone doesn't pick it up really well, but there is something about our brains. There's a place on our brain called the fusiform gyrus, which recognizes faces. But there's something about whispering and connecting that to face that gets to a deeper level than just talking out loud. And journaling is all important too, because our speaking, our writing, and our talking minds are all different. So this is why I think journaling is so important, because it gives you another perspective, another place to sort of anchor. So I
love that. I love that notion of dividing it like that, of just the writing, just because they are different forms of expression. And it's also, I like the writing it down, where when you write it down, you're then reading it.
Yeah. And you're creating it.
Yeah.
And it's a different part of I sorry to interrupt, but it's a different part. So it's kind of like getting three different perspectives on the same thing, which of course the gestalt of that increases exponentially, because the other thing about, our emotional pains, as well, is we tend not to really want to go into that, so there's a lot of blind spots. There's a lot of blind spots. And I think when you do these three things, when you speak it out loud, when you write it down, and when you whisper to yourself, you kind of pull all those things together, and it can be pretty intense sometimes, but it also gets to a different place than just sort of, yeah, that must have been really hard for you, right?
Well, and I also think it's that, as you said earlier, and I was just thumbing through Healing the Modern Brain, because the chapter on self-awareness, which is the first tenet of mental fitness, talks about this and kind of makes the point that we've really lost our relationship with ourself in a way, and we've lost a framework for it. We've lost some of these techniques, where we think about them as like in pejorative ways. Oh, dear diary, how like, masturbatory and kind of self-referential. Some of the data on journaling. So the prefrontal cortex, the part of our brain that's kind of the newer modern part that does a lot of our executive functioning, which, again, people are struggling with like brain fog and multitasking. So if this is you, this is a great idea or great technique for that. So journaling has been shown to increase the activity of the prefrontal cortex. They've done studies where people, I think it's 6 to 8 weeks of regular journaling, self-reflective journaling, how you're feeling, describing it, what's going on, trying to do less of like, Wednesday we went to play golf and then Thursday we went, but more of how you were feeling, what was going on, what are the deeper thoughts you're thinking. I always think like what you're struggling with, just like with therapy, like where do I start? It's like, where's it hurt? Where are you struggling? What's going wrong? Not that I just want to focus on the negative stuff, but that's what I can usually be most helpful on. And so, but just that science behind the journaling is kind of thing I get into in Healing the Modern Brain, of both giving people prompts, giving them some stories of how it can really help, sharing my own journaling practices, but also sharing, hey, like this isn't just like my opinion. There's really cool science behind it.
Mm-hmm. Yeah. And meditation and journaling also increase the size of the anterior cingulate as well. And the anterior cingulate is one of the parts of the brain that has real power over the amygdala, real moderating capacity over the amygdala. So the more you can build that ACC, meditation is probably the best, but journaling is another one. The more power you have, the more mental fitness you have in your ACC, the more ability and resilience and capacity you have in your nervous system to, as Daniel Siegel says, when you go outside of that window of tolerance, you can kind of pull yourself back in automatically rather than just spiraling out of control, for sure.
I think about it. Yeah. I think about it as like this buffer space, like the DMZ of my window of tolerance, where like I can wander into it and like some alarms go off and it's like, all right, and then I can wander back in, but it kind of gives me like a bigger window of tolerance. And then it's less scary to me personally, because when I cross over into this kind of, what I'm calling the DMZ, this area where like I'm outside my window of tolerance, but I'm okay because I know I can get back in. I find I live in a much more empowered way. Right, because I'm not worried or scared about being, let's say, activated or triggered or outside my window of tolerance as much, because it's like, oh, like I know just what to do to get back in. Yeah,
it's like the T-shirt that says "I'm in my own little world, but it's okay. They know me here." It's just you just get used to it, and I think that's how we heal specifically from anxiety. Is that we feel the alarm, we feel the DMZ, but we come out of it. And we go into it and we come out of it and we build this sort of tolerance like, oh, okay. So now we're no longer, as soon as we enter the DMZ, we're no longer these sort of pawns that have to go up into our mind and have to worry to dissociate from that feeling of alarm in our body. So when we can tolerate that alarm on our body, we no longer need the worries. And then when you learn that over the course of time, you can start letting worries go. And then you start getting some objective awareness of the worries, like, oh, okay, here's the same old worry again. And because you're not in sort of your limbic extremis brain, you can see those things with your prefrontal cortex and go, yeah, that's really not going to happen. I can have faith that it'll go. Now, is there anything we haven't talked about in this book? Yeah,
we haven't talked much about grounding, which is a tenet of going out into nature and taking off your shoes in the grass, and also just appreciating nature. You can see these plants behind me. It's very intense. I spend a lot of time in this office, and so wherever you can engage in nature, I find cooking is one of the ways I engage with nature. We didn't talk a lot about the tenet of engagement, which is about really building your cognitive reserve, not just playing Sudoku and doing crossword puzzles, but working on being more intentional with your hobbies. Like having a hobby decreases your risk of depression by 30%. and then we touched on it just a little bit, but to highlight the last tenet, which is the tenet of purpose, which is really asking you in a very, short and simple way to think about the types of things that fill you up, that give you joy, more than just the happiness from a piece of cake or a great Subway sandwich, but, some of that more deeper fulfilled happiness. What are the things you're good at? I'm really, as a therapist, intent on helping people celebrate things they have, things they're good at, skills they have. And so purpose, it's not like one thing, one time in our life and you've got it.
Right.
It's one of those things that evolves for all of us. But there's a request, again, because mental health is very insulated. If you look at people who have a sense of purpose, they just are much less likely to have struggles with depression or anxiety. People can ask, what comes first, the chicken or the egg? I think, look, we all know it's kind of, some people have more sense of a purpose than others, but it's one of those things, just like exercise, just like sleep hygiene, just like better nutrition, that you can build your skills. It's not kind of one thing, right? Having a purpose. I didn't understand much about feeling a sense of purpose as a mentor until I got called up by the American Psychiatric Association, and they said, we have this mentor program. We have a mentee that would like to work with you. I was like, well, my goodness, I've never even tried. I'm in my, I think, early 40s. I know I'm like a decade deep into an incredibly fun relationship with a colleague who, back in the day, he was my mentee. Now he's a good friend and colleague and psychiatrist and author. And so, I never would have thought about something like that as filling me up and give me a sense of purpose, but it has. And so that's one of the tenets that, again, is in there and in some ways is very straightforward and simple, but I hope people will feel inspired by the book. Russ, I think we're in a time right now where there's a lot of distraction. There are a lot of things, even for somebody without anxiety to be worried about. And it's a hard time to be cheering for people's mental fitness, but I think there's no better time. That, again, we're not here just to live symptom free. We're not here just to try and get rid of symptoms. We're here to live a life that is connected to others. We're here to live life with human purpose. We are here to experience growth and all kinds of wonderful mood states and experiences as human beings. And that's just taking more focus and more intention than it ever has. And the book is just I think, flagging that as an issue and hopefully offering some very affordable, very palatable
and accessible
fun.
Too. Like it's easily written too, like I really like the part about the zebrafish, the acrylamides.
Thank you.
It's really interesting just to see, acrylamides, if you don't know, they're in fast foods. They cause some brain issues. And one of the things that they use is these zebrafish, and the zebrafish can kind of mimic the neuronal structure of the human brain. And when the more acrylamide in there, the more these zebrafish tended to go off on their own and become these isolated. So you can see how, what we take in physically and emotionally affects us, and the more isolated we are, and we're in a very isolationist society, a very sort of us and them society, the more our mental health suffers. And I think part of mental fitness is saying, okay, I don't agree with you, but I can still see your value and your dignity as a human being, as opposed to this, place that we're going into now, which is highly separate. And it just basically really destabilizes us to the point where, if you had a tendency towards a mental dysregulation, this is going to bring it up.
Yeah, I think the polarization we're seeing denies the fact that we all depend on each other.
Yeah.
And whatever political party you're in, whatever country you're in, there's an interdependency. And I appreciate, people who know a lot more about this than I do are trying to sort out all kinds of stuff in terms of the economics of it. But I do think us as people, we need to remember that the connection between us and the interdependency between us is something that we can't deny.
Mm-hmm.
And it is a period where, as we are dealing again with more information, we're dealing with things like acrylamide and microplastics and all this stuff. There is a little bit more to learn, and there's a little bit more to do. But I hope people hear the encouragement that it, in the science, really pays off, and in my clinical experience, it pays off.
Yeah. So how do people find you, Dr. Drew Ramsey?
I'm Drew Ramsey, MD. I'm easy to find. I'm on Instagram every day. I run my own Instagram account, so you want to DM with me, it's not hard. I have a great clinical team here in Jackson, Wyoming, but also at the Brain Food Clinic, which is a digital mental health clinic. We also see patients in person in New York City. I've got a great clinical team. You can see all of that info on my website, drewramseymd.com. And the book is Healing the Modern Brain. I hope if you like this conversation, thanks for holding it up. I hope you'll check out a copy and leave a review. And
you can see little marks.
Well, Russ, I really appreciate you reading it and looking through it. It's great fun to talk with you and your love of science and the neurobiology of anxiety. And it means a lot that you find the book approachable and interesting, given all you know already. And it's great fun to finally get to meet you and talk. And I look forward to conversations in the future.
Me too. And, thanks for doing what you do, Drew. Thanks for being a clinician. It's really hard to be on the front lines. I was in it for a long time, couldn't take it, had to get out, did my own thing. I do my own way of helping people now, but there is a special place in my heart for people that are on the front lines, and I really appreciate you. So thanks for the work that you do.
Thanks, Russ. I really, given you've been there, it means a lot coming from you, and thank you so much. I'm here on Wednesday. I've had 2 long clinical days, and it's very inspiring for me to finish up my Wednesday, get to talk with you, and I'm going to go find some grounding and some brain food and a little family connection and snuggles with my Bernedoodle. And everybody, I hope this inspires you to take better care of your mental fitness and your mental health. And I'll see you down the road.
That's the best way to end. Thanks, Drew.